Of Maiduguri are facing double setback of scorching heat wave with widespread power outage that have seen many areas experience total darkness for days. These concerns have led to an outcry from the relevant authorities by residents battling with the double tragedy. Now, News Central's Maru Kirawa assesses the situation and now reports.
The Maiduguri Emergency Power Project, a gas plant, has been the major source of power in the city, which was largely seen as a relief to all. This was as a result of persistent breaking down of the sources of electric power by insurgents. It is 5 days now, and public electric has not blinked. This is raising a lot of questions on the lips of many residents. University of Maiduguri Teaching Hospital is one major area of concern to the citizens.
In the past, University of Maiduguri Teaching Hospital was the pace setter in health services, in healthcare development services delivery. So I don't know over the years what happened to the University of Maiduguri that the services are deteriorating. Only recently, fees were raised, the rates were raised, far skyrocketed far above the means of those who rush to the hospital to obtain healthcare services from all directions. Coupled with the fact that, just consider the economic situation of the country.
While it is commendable to witness the improvement in the over 1,000 bed capacity hospital facility with different centers dedicated for different ailments, questions about the sudden change in the cost of their services remains a cause for concern.
What is happening now, when you go there now, there's no light, and many patients are crying, and some people are without their patients to another state hospital. All we know that we are appealing to federal government, let them do something on them, because many of them are suffer. So we are appealing to federal government, let them do better thing for them.
All these utilities, electricity, water, they are not supposed to be in short supply. The teaching hospital must not, for less than a minute, have any power failure. Must not. A teaching hospital of this standing.
This video showed how the hospital is battling with the power outage, which requires swift response. I tried to reach the chief medical director of the hospital, but he was said not to be on seat. Perhaps the complaint of lack of adequate funding by the CMD during the 40th anniversary of the hospital months ago might be the cause of the ugly situation in the hospital.
They never have increased their tariffs. Sometimes our NEPA bill in a month will reach like 39 million. And our IGR, the whole of it is no more than 40 million. So we don't have money to buy any other thing. So funding, power, we all know the importance. The generators, we all know the 2 years that we went through without electricity in Maiduguri. We were spending virtually 60, 70 million in a month for 10-hour electricity. So funding is the major thing. I think governments should look at really the effect of the fuel subsidy. I think some of it can be also, the reliefs can go to it.
The residents of Maiduguri, however, hope that their concerns will be addressed promptly by the government so that normalcy can be restored with effective health care for citizens. In Maiduguri for News Central, Omoru Kirawa.
You're watching tonight. Coming up,